Hey everyone, we're running a couple of minutes late and a couple of minutes early at the same time today. It's definitely one of those crazy days. We wanted to reach out and say hi to everybody and share a weekly update and discussion about wounds and injuries is our focus this week. So I'm going to introduce my partner, Dr. Alex, and have her jump in. Hi, Dr. Alex.
Hi. Hi, everyone. Very sorry. Yeah, well, indeed, we are a little bit late, a little bit early under the normal standards. So we hope to catch quite a few more people. So the theme this week is wounds and injuries. And we had quite a few cases of wounds. We have in our group a dog that was severely bitten on the face, and it had quite a big lacerating wound close to the eye. Everybody can go and check. And we had a horse, beautiful horse, absolutely stunning as well, with a wound that has just been rescued. What else did we have? We had other wounds as well.
A cow with
a cow,
with
yeah,
the udder.
course.
Yeah, the very bad cut that she had.
Yeah, this poor cow, actually, we did a consultation yesterday. It was not just a post on Facebook where this poor cow was born blind. So she has a handicap compared to all the other animals. And she has been just being bullied by other two bulls and the rest of the herd and pushed into a barbed wire. So she had severe laceration wounds as well in her udder and tits, and on top she was milking, so she created an infection and probably mastitis as well. So yeah, there's a lot of wounds. And of course, my other half also suffered an injury. So Rebecca, can you talk about yours to start with?
Sure. Going back actually to one of the first videos we did about insects and bugs and stuff with poultry, our chickens, I discovered, had mites. And one of our broody girls who hangs out in the box way too much, and one of our roosters who sleeps with her, decided to infest the whole coop. And so we relocated them to a coop we don't usually deal with. And as in many places around the world, well, some anyways, at least in New England, we're getting rain every single day. And I just went bouncing out of the house, not thinking anything of it, and hit some granite steps and went flying and landed pretty precariously. Thankfully, I didn't bang my head or crack any ribs or, break my tailbone, but I definitely flew up in the air, and it was my right hand that caught me. So here I am, and super grateful for Arnica the last few days. Super grateful. Yeah, it's been great fun. I immediately came in the house, took an Arnica 200, dug out the Arnica salve, started putting that on my arm, got the ice, and took a few herbal tinctures in my water as well. Solomon Seal is one of my absolute favorite for muscle injuries, and I knew I was going to be good and sore. I haven't been disappointed. But the Arnica, by keeping up with the Arnica on a regular basis, and I did take your suggestion. I put it in water, Alex, and I was sipping on it a couple of times yesterday. I've got full mobility. I don't have any bruising. Amazingly, my wrist did not swell at all. It is not bruised at all. And I can tell you that I put my full weight on this and landed, completely bent on the granite steps. So, yep, that was my dance with Arnica this week.
So can you take the bandage just for a second?
Sure.
Because you say you're not bruised and you're not swelled.
Yeah.
But seeing is believing.
It's true. It's true. So no swelling whatsoever, which is absolutely amazing to me. There's no edema in here at all on either side. And as you can see, I can completely turn this. I can bend it, but going back is a little tender. It's here because of the hyperextension that happened. But yep, I went out and did chores this morning, threw my gloves on and, hauling around buckets of water. I wasn't lifting the buckets with this hand. Just trying to be a little conscious of that. But I did put more Arnica on last night before bed, and I did take another dose, but I haven't taken any today. So I've been using it, and yet another Arnica miracle. It's wonderful.
Yeah, but take at least one dose, because until all the tenderness goes away, at least once a day you should keep it up. And of course, miracles happen, but there was severe injury
and trauma,
because and trauma. Actually, Rebecca yesterday, immediately after the whole thing happened, she said that even her body was bruised because it's the shock, and she had a full fall. It was not just a hand. I mean, the impact was throughout the body, but on the hand, there was quite a lot, and on the wrist, quite a lot of impact. So the body, although it's healing very fast, and a lot of bruising and swelling did not happen, still the tissues need time to heal.
Right.
So until everything is 100%, when she can do yoga and handstands.
I'm going to try and avoid that actually for a little while. But what's interesting is today I noticed that back in this muscle is what's hurting. I put the bandage on to kind of remind myself to take it slow.
Slow.
Yeah, and just to keep the wrist in, that supported in that straight position. But yeah, today I don't know what I did, but the back of my arm, I was like, oh, look at that. So today is day 3. I did it 3 days ago. So this is the second day after the injury. And I always find that day 2 is when we're most tender. But I'm mobile.
Yes. You're here, you're working.
Yeah, I am working.
And the chicken have been fed, and the geese have been fed, and all the obligations. So it's just true. Not fine to give massages to anyone. Not yet.
Right. I can only imagine how the chickens they watched this whole thing happen. I am absolutely 100% certain that they were standing there laughing at me as I flew up in the air and landed down.
For a moment, I thought you were going to say that the chicken got traumatized or something because they saw you falling down.
No, they got their trauma having to be relocated because of all the mites and all that fun stuff. But, a little bit of Staphysagria and they're good. They're good. Yeah. So we have a lot of other remedies to talk about with the cases that we've had. Shall we talk about the cow that we had that case yesterday with the woman who had posted about her? She didn't share any photos on the page, but she did share them with us. And they were quite traumatic. She had run through a fence, a barbed wire fence, and gashed the full udder and really tore one of the teats. That was what we were talking about yesterday with this particular client, because the gash across the udder has healed pretty well, but that one teat has become an issue. If I recall, she said there were yellow, lumpy kind of clumps coming out when she was trying to milk her, but only out of that one teat. And it had quite a raw gash on the side of it, almost splitting it. So initially on the page, we had talked about, because of the mastitis component and the lumpiness of the milk or the discharge, we had encouraged her to use phytolacca, which is very much a mastitis, and it is one of the keynotes is the lumpiness that comes out of the breast. So that was to address what was going on the inside. But Dr. Alex had a brilliant suggestion, and I want her to talk a little bit about that remedy with regard to the actual wound to the breast.
So from the post, we did not have really a clear picture, and that's why, you know, when it is some serious condition, even if it is an acute condition, it's much better to have an acute consultation. So the lady, although or in spite of the animal feeling better and the lumpiness, and the other problem was that there was not only the lumpiness, there was, you know, the milk did not have the ability to come down. And of course that it was so lacerated, and poor animal was in such big pain. That's when she posted. And then after following Rebecca's suggestion, the animal actually started to improve, and the milk started coming out of that teat. But still she booked an acute consultation because the condition was serious and she wanted to make sure that everything was being done properly. So after taking the case and talk about the symptoms and seeing the circumstances and knowing the character of the animal, we decided to go keep the phytolacca, since it did a good job, to be honest, but another remedy was fitting, that was matching the mental and the emotional and the cause of being rammed in, because she was not just, you know, it wasn't the question that she tried to jump a fence, she was actually bullied into it. And on top, she's a blind animal, and on the consultation we found out that she's blind from birth. So given all the history, we decided to go with Bellis perennis. And Bellis is a very big trauma remedy. It's very similar to Arnica, but goes even deeper than Arnica, and belongs to the same family as Arnica, the Compositae family, which the Compositae family, the big theme is always trauma, and it has a special affinity for the breast and the pelvic area. So it was, you know, a double whammy, because just so happens that the teats and the other is in the pelvic area. She was rammed into that. The trauma happened on that and on the teat as well. So, and it was severe trauma.
So I've just put a picture up of the udder that shows the damage from the initial barbed wire. And I'm going to switch over to the actual teat, which is current. And that has the wound on the outside. And I think several of you that have worked with us that have had you know, fresh wounds like this, also the dog that we'll talk about in a minute, we had recommended a spray of 50/50 calendula and St. John's wort or Hypericum tincture, actually the herb tincture. And if it is a little raw or a little too much, typically the Hypericum will help with that nerve pain. So even though the alcohol might sting, they will get some pretty rapid relief from that. And the calendula is so good about cleaning the wound and helping it heal thoroughly. So I just wanted to share those two pictures so everybody could get a sense of what we were looking at. And we saw these after actually we had taken the case.
This is beautiful, Rebecca. Thank you so much. It's absolutely perfect. I'm going to jump in with another remedy to compare with calendula that we use a lot for wounds, which is Staphysagria. So the way to distinguish calendula from Staphysagria, both are cut wounds and bleeding, etc. But with Staphysagria, it's a clean cut wound. Can't remember if it was this week or last week that I had someone that stepped on a propeller on the beach.
That was the same woman that we were talking to yesterday about the cow. It was her son.
Okay. So yeah, so that it wouldn't be calendula, it would be Staphysagria. So first, or surgical interventions, any kind of surgery where it's done with it's a clean cut. My son many years ago in a very rural area walked through a door that had no indication, and it was not double glazing of glass, and the glass came down as guillotines and cut him completely. Again, Staphysagria, it's clean cut, it's from glass. Now, calendula, it goes beyond Staphysagria. Is when you have lacerations. Think of a wound from the barbed wire, it rips apart the flesh. Wounds that are difficult to stitch because it's so torn. Or when you have massive abrasions, it happens a lot with the kids where they skid on the cement with their raw knees, and they completely, and they are actually, this type of wounds are superficial, but very, very painful. And usually they get very, very infected because of all the grit and the debris that gets trapped as the knees are scraped or the legs are scraped on the cement or sandy places or gravel or what have you. So this is the main differentiation between these two remedies. Calendula will also, because of this type of wounds, works very well on infected wounds. Usually there is a bit of pus and pus or serum oozing out. Hypericum is our next remedy, which is amazing when there is a lot of nerve endings or a lot of pain in this guy. For instance, is complementary to calendula, is complementary to Staphysagria. And if there is a lot of pain in the wounds, or the wounds are on the fingertips or on when there is a lot of nerve endings, or if you fall on your coccyx, your tailbone, which again is it's an area very rich in nerves. Hypericum is definitely, you can alternate Arnica and Hypericum. Arnica because there's a blunt trauma, there is a bruising because you fell on your bum, but because there is a lot of pain and usually shooting pains that go up the spine, you can alternate Arnica and Hypericum, or crushed fingers. Again, fantastic. Arnica and Hypericum, you know, kids get their fingers crushed in the car doors or, well, indoors basically, and windows. How
Well,
many times they have the hand out of the window,
out the window, yeah.
and zips the window up electrically, and only when you scream, they, yeah.
So they stop,
So
sure.
this is very,
Well, and when you think about the animals too, there's so many opportunities for Hypericum because if you're in a true farm situation, and they have to be, you know, whether you have sheep and you shave them and they all go into the, I'm trying to think what they call them, where they get them all in single line and they're all in these gates, you know, where they're being pinned, that sort of thing. Sometimes they come out of that with injuries, right? And same thing with pigs, cattle, the horses, when they're coming on and off of the trailers, you know, if you're moving them around, and gates, yes, precisely.
gates,
Yeah,
rusty gates, sometimes even on the fields, on hikings, you know. They measure well their distance, many others they don't measure well, so as long as their neck passes, they forget about the rest of their body that is slightly wider, you know. And they forget very often our knees, you know. Many times I just go,
right. Yeah, they don't care that you're sticking out. They're only concerned about how much space they take. So yeah, that's very, very true. So there's another good thing for having Hypericum in your first aid kit when you're out riding is, you know, if you get your knees banged really bad, that shooting pain is just brutal. And I think any of us that have been on horses or been crazy enough to ride cows, because I used to do that as a kid too, you know, they'll run you into things and the pain is pretty significant. So Hypericum is good to have on hand. So what about Rhus tox? That was one of the remedies that you and I had talked about discussing with wounds and injuries. What's your experience using that with animals, Alex?
Well, again, Rhus tox is great when there are injuries to in the joints. It has a big affinity to tendons. So if they sprain and strain, and for instance, you were very lucky, but it could be that Arnica would help, but it would not be good enough. So if you give Arnica and there is an improvement, but then there is still swelling on the joint, on the affected joint that was sprained or strained, or sometimes the animals jump and they overestimate and they land hard, and then, you know, they are limping for a few days, and you give Arnica and Arnica does not solve the problem. Rhus tox is a very good remedy to go to, especially when you see the animal with the first movement being really in pain. Let's say the dog was sleeping, and when it gets up after having, you know, a big jump or a big fall or spraining
Or just a hard run
limb,
or anything like that.
yeah, and you see them going really, you know, slowly, and you can see they are in pain. But as they start moving along the day with gentle movement and the body kind of warms up, they live up, and after a while they're fine. And then they go back to a nap, or, you know, overnight they are okay, but again, next day they are really in pain. And we call actually Rhus tox, when I was studying it, when I was a student, many springs ago. We called it the rusty gate, because usually gates on the farm, when you try to open, they are really stiff and hard. And then sometimes, you know, the first, they're like stuck, and then they go and they swing out. So the first movement, it's really difficult, and then, you know, it improves. So that's a good remedy. The next one is Ruta, and Ruta, think about Ruta of the shin injuries. It's basically injuries to the periosteum. So it's blunt trauma like Arnica, but people that are playing football are, you know, kicked in their shins, or animals that jumping, or, you know, anyway, going over boulders, they kick their legs and they are lame, and there is not so much bruising, but you can see there is a lot of pain. Anyway, it's injuries on areas of the body where the bone is very close to the surface.
To the surface, yeah, yeah. And can also be for repetitive injuries as well. If an animal continues to injure that one spot over and over and over again, Ruta can actually be very, very good for that. I've seen that in, you know, not animals so much as hockey players, and like you had mentioned, somebody that plays sports and constantly re-injures that spot or does damage to it or what have you. And Ruta is a wonderful, wonderful remedy for that. I wanted to share the photos of the dog that had the laceration on its face, and talk a little bit about this particular case, because this was really remarkable, the shift that happened overnight. And if you give me just a second, I'll share that picture. There she is. So this dog actually was bitten by another dog, was attacked. And the owner posted on our farm animal page. Unfortunately, we both happened to see it. And she was saying, you know, okay, I've done this, but what else can I do? And, you know, the trauma that goes with something like this, a bite from another animal, it's not like they just walk up and, you know, clamp onto you or what have you. This is typically an aggressive situation. And there's a lot of fear and anxiety and trauma that goes along with it. And this was a pretty deep wound. And for dog bites, there are a lot of remedies. But we both responded pretty quickly. I believe she started with Ledum. Does that sound right, Alex? When it happened, if I'm not mistaken, I want to say that she did.
I think that Ledum was the remedy that she started
with, yeah,
for sure, which is good. It's a good remedy for bites, but more puncture wounds. But since it was a bite and Ledum has antitetanic properties, so it was not a bad choice. And then she followed up with Calendula. No?
Yes. Yeah. And we recommended that she do external tincture of Calendula as well. I know she was a little hesitant to do that because of the depth of the wound, but actually Calendula is amazing pretty much on any wound. That's been my experience with animals and people. And I've seen some pretty deep gashes, and Calendula tincture, because it's alcohol and the healing properties of the plant, it will actually clean the wound and help the tissue heal. And if I'm not mistaken, I just want to jump back in here really quickly and see if I can find, she posted a picture the next day. And I'm going to grab that really quickly. It was wonderful to see the response. And it was less than 24 hours later. I think it was like 12 hours, maybe. Let me see if I can pull that up and share it with everybody.
But she took it as well internally, I think.
She did. Yes, she
Which
did.
is the best of both worlds, really. I mean, calendula is amazing, the way it promotes granulation. And while Rebecca is looking, perfect. Yeah, you found it.
Yeah.
Can you enlarge it a little bit?
Let's see. How's that? Does that?
Beautiful.
Okay, great. Yeah. You know, now you can see a little pus in her eyes. I think we recommended that she do some eye drops and to stay on the Arnica because the trauma is still there. Even when a wound heals quickly, just like my wrist, there's still trauma in the body, in the psyche, in the energy of the animal or the person. And Arnica can really, really help to soothe that. And then if there are other symptoms that show up, like for instance, with her, the pus in the eye, you know, that's something that you want to watch carefully because this wound was very, very close to the eye and it was very deep. So
I have to say that it's very important to notice that this dog has no stitches.
Yeah, no sutures at all, which is just beautiful. Yeah, and again, this is less than 12 hours from her start to finish, which is really, really remarkable. And if anybody wants to follow the story and the owner, they can absolutely go back in the farm page and check that out. So
like in most of our cases.
Yes.
One final word on calendula, because as you see, it promotes granulation so fast of the tissues. You need to make sure that the wounds are very clean. So you flush them with water
or saline.
Or saline or water with a bit of hydrogen peroxide, but you flush them well, because especially when these have been scraped on concrete and they have grit inside, it closes the wound so fast that can close debris inside of the wound.
Very,
so just
very
make
quickly.
Sure that the wound is well cleaned. That's it. Any questions?
I haven't seen anybody jump on, but let me just see if I can.
Because I really cannot see.
I know, and
from my end.
Don't see anything that's popped up so far. No, we do have a couple people watching though. And the other thing that I was hoping to share was the horse case that also came up on the page. And I'm going to have you, Alex, if you will, because you actually dealt with her directly. You two were communicating back and forth. Talk a little bit about what happened and how the horse came to the injury and so on.
I have so many. I'm very sorry. You have to.
It's okay. So this was the horse that somebody posted, that big, beautiful black horse that had been injured and was at an auction, and this woman's neighbor went and purchased this horse, but it had been attacked and it had a big wound on the bottom of it. She had sent us a video, and I'm going to see if I can find it real quick. The initial video. Yeah, let me grab that.
Sarah Saunders.
Let me share my screen really quickly. That's okay. Okay, Summer Dawn.
Summer Dawn.
Yeah.
Oops. Okay.
So this horse
has a massive wound somewhere there where we cannot see very well, but it's been cleaned and flushed with water. And
Yes.
actually the poor creature has been so nice and so accommodating.
And then it was transported, I think after this video, it was
Yeah.
transported to its new home. And of course, they were worried about trailering and all of the stress. And after being in, I don't know if it was in a kill pen or not, but it was at an auction house, and those are not super ideal. So this injured animal showed up on our page yesterday, the day before. And let me see if I can grab the follow-up video. So you two had kind of gone back and forth, and you talking about calendula for the wound, the tincture, and then and also calendula internally.
Absolutely.
And then we had recommended, if I'm not mistaken, aconite and arnica.
Aconite and arnica in alternation, just a couple of doses for the transport, because obviously she had a lot of trauma, and then we did not know, but most probably she was going to be in trauma to get into the trailer and be transported to a new place again.
So
because
we have
this horse,
go ahead.
I know the history was abused, and then went from that into a rescue center, and then in the rescue center she was actually rescued by this the friend
neighbor.
Jill, the friend of Sarah
of Summer. Yeah. And so now I'm going to share the follow-up video. This is after they had transported her and given her the aconite and the arnica.
Yeah, after actually doing the treatment, and it's so amazing. I mean, it's a beautiful mare. I mean, look at her. Yeah,
she's so happy. You can tell that she knows she's in a good place. Yeah.
She's like, oh my God, I'm in heaven.
Yeah.
Look at this.
Yeah, the energy is just fantastic. So it's really remarkable to know that an animal can come from such a precarious and stressful and anxious situation. And horses can be so unpredictable, especially when you're trailering them, or they're, being relocated to various different places, and where they don't know anybody, they don't know what to expect. The anxiety can be really, really high. And on top of that, to layer the injury, with all of those other pieces, and then to insert some remedies into this situation. And see,
I think there is another video as well of her just grazing, like I am at home.
Yeah, just happy, just really, really happy
and so calm.
Yeah, let's see if I can find that one too. And just yet another homeopathy success story. I mean, we're just so grateful to see these. Let's see. Okay.
Well, I also have to say that animals being forced. Oh yeah, there she is. Just grazing.
Yeah. Just
chilled. Totally chilled.
Yeah. And if everybody that has horses, even if, they've been in their possession for a long time, and they are being transported or what have you, keep the arnica and aconite close, because the shift that it helps just in their psyche and their energetic picture, and how they're feeling with stress and so on and so forth. It's really, really beautiful. So we're thrilled to have connected with everybody today and to share all of these success stories. And thank you for spending some time with us again. We're really pleased to make these videos every Thursday and hope that everybody is getting, some folks are actually getting some benefit from this. If you have questions, if you want more information on the remedies that we talked about, and obviously, you can certainly follow the case as well on the farm page. We would love to hear from you, and Dr. Alex and I are here to support, to help, whether it's on the page. If you have an acute, if you have a chronic, please consider getting in touch, booking an appointment, touching base with us. We are Homeopathy United. This is our contact information. And you can find us through here or through any one of those means. And we also have our own Facebook page of Homeopathy United. And we'll post a little bit about the remedies that we covered today in the comments of the video. And again, if you have any questions or comments, we'd love to hear from you. So thanks, everybody. Thanks, Dr. Alex. You did a great job.
Oh,
thank you.
Thank you.
Thanks for helping me with my hand. We'll see you again soon.
Yeah, absolutely. My pleasure.